Okay. Okay. Good morning, ladies and gentlemen, friends, colleagues, and some patients, and maybe some students from UNIMAS. I'm Dr. Clarence Lay, and I'm a urologist. So for the next hour or so, we will try to educate each other on urinary stones. This is a public forum, but many of my slides are quite scientific. But I will explain as we go along, and I hope at the end you can ask me some questions, fire me some questions. So as a urologist, my main activity is looking after the kidneys, the ureter, the bladder, the prostate, the penis, the urethra, the testicle, and even in the kidney, we've got different parts of the kidney. So stones, urinary stones can occur in any part of the urinary tract. The kidney, the ureter, the bladder, the prostatic urethra, the urethra. So today we'll discuss on urinary stones. Okay, another day we can talk about other things if you are interested. Now, how common are stones? The international series of stones says that it's about 5 to 15%. And you can see from the diagram, it's mostly the higher incidence are mostly in the hot area, hot area. What about in Malaysia? How is the incidence in Malaysia? There's a study in Taiwan, where the composition of the people are mostly Chinese. They came to Malaysia for international meeting in the year 2000, and they did a survey on Taiwan, because Taiwan is a small country, so they can do a good survey of the community. And they said that their incidence is, in the female is 4.3%, men is 14.5%. So why is it the men in Taiwan have got more stones than women? Okay, so we can discuss that later on. And internationally, you would think that as we progress, we will have less stones. But in actual fact, over the years, there's an increased number of stones. Of course, there can be many reasons for this. But some people blame it on global warming. So because you are warm, so you sweat a lot, so you have more stones. But of course, there may be many other reasons like dietary, lifestyle, and even genetics. Now, what about in Sarawak, in Kuching in particular? So this is a brand new study sponsored by the National Kidney Foundation. National Kidney Foundation sponsoring study in Sarawak. Okay, bear that in mind. And this is published by a registrar in the General Hospital, Dr. Kamal, and headed by Dr. Teh Kwan Chow, the Chief of Urology in Sarawak. And from their latest study, what they do is they did ultrasound study. They did not rely on questionnaire. They did the ultrasound study of patients who go to the clinics in Sarawak, healthcare clinics, doing ultrasound. And they find that they survey 1,000 of people, and the incidence is only 4%. And they find that it's the same in the male or female. And the age group is 25 to 64. So these are the young people, young people. I'm 65, so maybe I'm already. And from the risk factors, the main risk factor is having a high salt diet. Of course, family history and personal history, they are also significant risk factor. Hypertension is a risk factor. In many other studies, they quote diabetes as a risk factor as well. So what are the stones? What are the stones that we have? Calcium stones, stones caused by UTI, urinary tract infection, stones which are due to too high uric acid in the urine or in the blood. And these stones are radiolucent. In other words, when you do X-ray, you see through the stone. You don't see the stone on X-ray. And 16 stones which are hereditary in nature. I don't see that many of that in Sarawak. But when I see GHKL, I've seen quite a number of 16 stones. These patients tend to have stones in the young age, stones in every part of the urinary tract. So these are the picture of the stones. These are the stones that we used to remove in olden days. Nowadays, we don't do much open surgery to remove the stones. So these are the calcium stones, uric acid stones. International series is 10%. But in Malaysia, it's about 20%. We've got no more uric acid stones in Malaysia. And infectious stones and 16 stones. So this is a study done on almost 250,000 stones published in the Journal of Urology. Before I left GHKL in 1995, I studied all the stones in the GHKL, all the stones in children, pediatric stones. And I find that only about half of them are due to an underlying disorder. Because obviously, if you're a child, you have a stone, you want to prevent a stone. So it's very important to find out what is the underlying cause for the stone. 65% of them are classified as idiopathic. What does idiopathic mean? Idiopathic means we don't know. We don't know. So actually, many of the patients who have stone, in fact, many of the diseases that we treat, we actually don't know the cause. We don't know the cause of the stone. Now, when a patient has a stone, how do they present to us? The most important thing is pain, severe pain. And for the man, that is the most painful thing that you can ever have for a man. Of course, for a woman, they have many other pains. The second presentation is blood in the urine. Sometimes the blood is not seen, but you have to do a urine test to see the blood. Sometimes, especially in females, the presentation is infection. And in some patients, because the stone is in the lower tract, they have lower urinary tract symptoms, but very much like prosthetic problems. And finally, like many diseases nowadays, the presentation is because they went for a checkup. They went for routine tests, especially in ultrasound. Then they come with the stones. So this is the presentation, how these patients end up seeing a doctor. Now, where is the pain? For a stone to cause pain, usually it has to be in the urinary tract. Okay, so the classical pain is from the loin to the groin. Okay, loin to groin. So if you have a pain from loin to groin, it is likely that you have a stone in the ureter and you are suffering from a condition called ureteric colic. Okay, this is the most severe pain a man can ever have, most severe pain. The pain is usually not at the buttock here. A lot of people said, oh, saya sakit pinggang. Actually, the pain is in the buttock. That is not due to a stone. That is due to some other musculoskeletal pain, which can be treated by other means instead of treatment for stone. Now, people like to do some tests to confirm they have stones. So the first test that people do is a urine test. So if you have a stone, usually you will have pus cells, you will have blood cells in the urine. And if you have fever, you check the urine for infection. You get urine for infection. Okay, and of course you go for imaging, imaging, the commonest imaging, because this is a public forum, and usually in every public forum people ask about cost economics. So in this case, I put the money up front. Okay, I tell you what is the cost up front. And these figures are for Malaysia. I think the prices of things in Malaysia for medical treatment, for investigations, they are fairly fixed by the government. So ultrasound or X-rays, and sometimes we do CT scan. We do CT scan, but the CT scan for stones is not one that you have to give an injection. There's no contrast. You just drink water and you go to do the CT scan. And of course, when we talk about kidneys, we talk about the kidney function. And how do we know the kidney function? We do blood tests. Okay, blood test creatinine. Creatinine is the measure of the kidney function. And at the same time, we try to test the blood for whatever reason they may have stones, calcium high, uric acid high, and look for infection by looking at the cell count. And of course, because diabetes is so common in Malaysia, we try to check for diabetes for every opportunity that a patient comes to see us. We try to check for diabetes. Now, so I show you some examples of scan. I go through it quickly. So I think most of the clinics will have an ultrasound. So you put an ultrasound, you can see the stone is there. You see a big stone in the bladder. So if you have got urinary symptoms and you are being treated for UTI, your UTI will never recover because you have to carry up the stone. You can scan the kidneys. This is what a normal kidney look like. And this is the kidney that has what is called hydronephrosis. In other words, there is water in the kidney, hydronephrosis. So if you have hydronephrosis, then it's possible that you may have a stone in the urinary tract, Okay, so this ultrasound is very good as a screening test at any time of the day and night in most of the clinics. Then of course you need to do an X-ray to confirm it. In Malaysia, we like to do an X-ray unless you are pregnant or you are a child, and X-ray will show as an opacity here like that, opacity. Okay, but of course, not all the opacities are due to stones. Opacities can be due to other calcification. In this case, the opacity actually here is due to a calcified appendix, also on the right side. So that's why we need to do a CT scan nowadays as a standard of care, SOP, SOP, standard of care to confirm stones, unless you may be pregnant, you are going to be pregnant, or you are a child. So this is the CT scan showing a very nice kidney, nice ureter or urinary tract. This shows that there is a stone there, and this particular one shows the stone lower down there. Okay, this one is a normal urinary tract. Okay, so the CT scan now is the standard of care. So don't be frightened if you go to the hospital and you're suspected of having stone, and then the doctor says, okay, we have to do a CT scan. Unless there's some contraindication, otherwise most of the time we do a CT scan. So what is this CT scan? CT scan, we need it to confirm the stone size. We need to confirm exactly where is the stone and any abnormality. And the CT scan can also tell us how hard is the stone. And also we can see how deep is the stone. If the stone is very far from the skin, so some patients nowadays are quite obese, they're wearing 100 kilos, then it makes it more difficult to treat the stone. So obesity to me is a risk factor, although we did not find it in our survey done by Dr. Kamal earlier on. So how do we treat stones? Okay, the first treatment, of course, is to relieve the pain, Okay, if the patient has got pain, they have to have pain relief. And of course, depends, the medicine we give depends on whether the patient got any allergy. If the patient is allergic, then we try to avoid that medication. If the patient has a history of gastric ulcer, peptic ulcer, gastritis, we also avoid medication that can cause peptic ulcer. So usually we give them pain relief. We try to give the pain relief that is non-sedative. So we try to avoid things like morphine, because if we give morphine, the patient will have to be admitted to hospital. And we give them something to make the urine alkaline, okay, so that we try to dissolve the stone. Of course, there are many other traditional things that people take barley water, they take the olive oil. This is the oil. Ravatinex is an oily product. People take herbals. I will not say they have no effect. They have some effect on the thing. But the main medication that the Western doctors like to use is to alkalinize the urine. Alkalinize the urine, because if the uric acid stone is there, if you alkalinize it, even a big stone can be dissolved. So alkalinization and citrate. Citrate is a stone inhibitor. If you have citrate in for example, lemon juice, they have citrate. So these are good for stones. And if they have a stone, they usually take it 3 times a day for a couple of months. It takes some time to dissolve the stone. So that's the role of urinary alkalinizer. There are studies done locally. They're done by my good friend in Chiang Mai, Professor Banagit, and they also studies done in India, and it shows that actually even very big stones can be dissolved without surgery. So alkalinization of the urine, taking citrate is very useful as a medical treatment of stones. So and the main product that is used in Malaysia, in Australia, this is an Australian product, URINARY, is to give the patient urea sachets. Urea sachets, it contains a lot of citrate, but it also contains sodium. So if you take it for months and months, it may aggravate your hypertension. This is quite expensive. I think it's about $1.50 per sachet. So 3 times a day means about 5 ringgit. So it's quite a lot of money. But you can also get a similar preparation from the government clinics. Okay, so this is the URINARY product. Another new thing this is a new thing. So public forum, we try to talk about new things if possible. New things. So another thing is called the MET, medical expulsive therapy. Say, doctor, can you give me a tablet to expel the tablet? But actually, there's no such tablet. The tablet that we give is something to relax the urinary tract. Okay, one of the silodosin, tamsulosin, prazosin, one of the medications that we traditionally use for hypertension. Okay. So this is the way that we what is called medical expulsive therapy, but it's only useful for stones which are in the lower ureter. So if you have a huge stone in the kidney, there's no point taking medical expulsive therapy. So I think what I'll do is I will continue to finish the lecture, and then we try to have some Q&A at the end. Okay, a lot of patients in Malaysia have a high uric acid. And the common drug that people use is called allopurinol. Allopurinol. It is taken in a dosage of 100 to 300 milligrams. So if you take half a tablet, it is 150 milligrams. But the danger of many medications, including or especially allopurinol, is that some people are allergic to it. So if you're allergic to it, then you cannot take the medication. There's another medication called Feburic. But again, this medication is quite expensive, and also it costs 10 ringgit, so it's quite a lot of money. And they also got side effects. So as I said, we try the non-medication therapy. Okay, so can patient pass a stone? Which are the stones that patient can pass? All right. Now, stones which are less than 6 millimeters can be passed. Less than 6 millimeters can be passed. Okay, less than 6 millimeters can be passed. Anything more than 6 millimeters will not pass. Okay, so they require some kind of intervention. So patients can pass a stone, and usually I give them a sieve, and then they collect the stone and put it in the bottle, and we can send the stone for analysis. Now, what are the biggest stones that we see in Sarawak? One of the classical stones is called a stacked horn calculus. This is called a stacked horn calculus. Why is it called stacked horn calculus? Because it looks like the stacked horn calculus. These are big stones. And these stones have been there for years and years, maybe even 10 years. And usually they're quite silent. They're quite silent because they don't cause a blockage of the urinary tract. So stacked horn calculus are still very common in developing countries. I said to say they're very common in Sarawak. Now, what I said earlier, that these stones actually don't cause much pain. So what if the old lady said, I don't want treatment, I don't want to go for surgery? If I leave the stone alone? So what is the natural history of the condition? So whenever we talk about condition, whatever it is, like COVID-19 or whatever, we must know what is the natural history. So the natural history of a stone is that eventually they'll cause infection. And this is a CT scan of a patient that I've seen earlier. And this shows the stone in the kidney, and this is the infection, the pus there, the pus collection. So if you've got pus inside the body, and if you don't treat it, of course the patient will die for severe infection. The bacteria will go to the brain, go to the lungs, go to the bloodstream. So they will form pus, and you must drain the pus. Okay, this is in 2008, but I can tell you it's very much the same now. It's very much the same. So the natural history of untreated big urinary stones is that they cause infection and the patient will die. What about if you're pregnant? You're pregnant, you've got a stone. So obviously, if you're pregnant, you cannot go for X-rays. And you also cannot go for invasive surgery because that can create abortion or miscarriage. So if they have pus during pregnancy, then we just put a tube. We just put a tube and let the pus drain out. So when the pus drain out, the patient goes through the pregnancy, and after the pregnancy, then they can have the stone treatment. So for pregnant ladies, if you've got fever, go for early treatment. So what are the emergency situations? What are the emergency situations for stone treatment? If you have got fever and chills, okay, fever and chills, and if you have a stone that's causing a blockage, and especially if you are female, not the male, very strange, female. If you are female, you got fever and chills, you got a stone, then you require emergency admission. And very often you require emergency intravenous antibiotics. And sometimes we need to put a tube, like the lady just now, we put a tube and drain the pus. If we cannot put a tube, then we put a tube up the ureter, like called ureteric stenting. So if you don't treat, you can die from this, or you can die from a stone in the ureter. Now, when patients go for any form of surgery for stones, they always like to say, I want to have laser. I want laser treatment. Okay, I want laser treatment. But actually, not every stone is suitable for laser. Not every stone is suitable for laser. Because the laser machines are very expensive, and there are different kind of settings that we use. Sometimes we don't actually have to use laser. So actually, in fact, we don't use laser quite often to treat stones. As I said earlier, the most important thing is medical therapy. And big stones have to be operated. So this is open surgery. This was very popular about 20 years ago. For 40 years. So during my first 20 years of my career, we do a lot of open surgery, but nowadays we seldom do open surgery anymore. Okay, this is open surgery. You can do it in any hospital, even in very rural areas. So these are stones which are in the bladder. Okay, they are like eggs, stones in the bladder. So previously we will operate and take out the stones, but nowadays we can crush the stones using many devices, including laser. But of course, if you use laser on so many stones, it will take a long time. It will take 4 or 5 hours. So we use other mechanical devices to crush the stone. So these are the stones. which was removed from the patient. This is in earlier years. This is in 2008. So nowadays, we usually try to use some other medical technology to crush the stone. Of course, we still have to remove the stone. We are not magicians. We still have to remove the stones. Now, what about if the stone is in the kidney? If the stone is in the kidney, it's a long way to pass the instrument from the penis or the urethra, the bladder to the kidney. So usually, if the stone is in the kidney, the doctor will puncture the kidney. So it's called percutaneous nephrolithotripsy. Nephrolithotripsy. So this is done in the operating theater. We need to have X-ray. We need to have a monitor. We need to have irrigation. We need to have anesthetist to do the procedure. And of course, it costs a lot of money. And at the same time, stone actually is an infection. Stone is an infection. And if there is not proper monitor, the patient can also die from infection. So sometimes the patient may need to go to ICU. And of course, when you puncture the kidney is a very vascular organ. So 5% of patients who go for surgery can have severe bleeding. Okay, so now you can see that actually stone treatment surgery, like any surgery, has got its risk as well. So stone surgery by itself is not exactly that straightforward. So it's very important that you try to avoid stones. What if the stone is in the ureter? Now, if the stone is in the lower ureter, just the rambutan, I use this rambutan for my public forum. So if the stone is lower ureter, the chance of removing it by putting a scope is almost 100%. But if the stone is in the upper ureter, the stone is upper ureter, the stone is in the upper part of the rambutan, so you try to remove it, it's more complicated. You can even injure the urinary tract. Okay. Of course, if the stone is the upper ureter, we try to treat it by other means. But of course, nowadays we got better instruments, we got better equipment. Many patients can be also be treated by endoscopic means. We seldom do open surgery, but sometimes the patient said, I'm from Indonesia. I'm here only for 2 days. I want the stone to be removed as efficiently as possible. So sometimes we still do occasional open surgery. So this is the stone, this is the incision, and this is the stone that's removed from the patient. This is about 1 inch to 2.5 centimeters. So it's quite a big stone. But generally speaking, we try not to do open surgery nowadays for urinary stones. So we do percutaneous surgery. We can also pass an instrument all the way to the kidney. But as I said earlier, if you climb the rambutan tree to get the rambutan from the top, this can happen. You can injure the urinary tract. And of course, we have a lot of new technology, but often this new technology are commercialized. And once it's commercialized, we're talking about expense, and they are very, very expensive. So ureteroscopic removal of stones is 7,000 to 10,000. If you put a scope all the way to the kidney, we use what's called a disposable scope. So the disposable scope itself is for 5,000. And we often have to use the laser machine to break the stone. So that's another 4,000. So unfortunately, healthcare, not so much the fee for the professional, that means the fee for the doctor, but the instrumentation is extremely expensive. And very sad to say, it's quite often unaffordable for people in developing countries, including in Sarawak. So these are the stones that are removed by endoscopic surgery or keyhole surgery. These are the debris that's removed from the kidney, and this having a look inside the kidney, percutaneous. So before the operation, you see a lot of stones there. So we crush it by a mechanical device. Mechanical device, very much like the road builder, the one who crushed the stones on the road. This is the same device. It's called the lithotripsy. We crush the stone and we take out the fragments from the kidney. Okay, so this is kidney clear, but it can never be 100% free. So patients who go for surgery must understand that very often there'll be debris left behind. It's almost impossible to suck out all the debris. To suck out the debris will cause damage to the kidney. So it's the balance between removing the stones 99%, and removing the stones 100%. And even if you remove the stones 100%, you can form new stones again. So it's important that you have carried out preventive measures. I talk about the prevention later on. So this is the removing the stones. Now, the other important thing about any treatment, any procedure in life is talk about a success rate. Okay, I think no treatment can be 100% success. So this is the result that the study that I have done some years ago using the lithotripsy, lithotripsy to break the stones. So the success rate depends on where the stone is. And mind you, the success rate, the best success rate for stone fragmentation is only 62%. Only 62%. So we mustn't go away with the idea that that stone treatment is 100%. So if the patient thinks that he goes for a treatment is 100% stone free, he will be very angry. He will be very upset, not only with the doctor, but with the whole system. So I paid $10,000 and I still got stones in my kidney. So it's important to have this understanding before you embark on anything in your life, not at least for medical treatment. So the success rate is only 62%. But if you discuss with the person, okay, if I do not do the treatment for the stone, the chance of your stone inside your body is 100%. There's no chance of removing the stone. But if the patient understands that, okay, if I go for this treatment, I got a 50% chance of having no stones, but 50% chance the stone will still be there. But it doesn't mean that you cannot remove the stones. We can use other means to remove the stones. So the success of treatment for each procedure may be different. Okay, so there is in medical treatment, like in anything, there is a team effort. So this is the machine. This is the machine for breaking the stone. Okay, there are different models. This one happens to be French. This is the older model. This is the German machine. And of course, it's a teamwork. We have nurses. We have the kidney specialist. This is Dr. William Chow. He's a kidney specialist. So he has to look after your kidney while we do the treatment for your stone. So this is a team effort to look after you. And rest assured that we have the best team in this hospital. So this is stone removal without surgery. But bear in mind, even if you don't do surgery, it still has got its risks. There are risks as well. So this technology actually came from aircraft technology. So the Dornier technology. So the aircraft generates shockwave. So this treatment is called extracorporeal shockwave lithotripsy. Lithotripsy means the Latin word for breaking the stone. So it's delivered from outside the body. So this extracorporeal shockwave lithotripsy, the short form is ESWL. So this is the greatest advance in urology for the treatment of stones for the past 3 decades, I think. So the shockwave is generated by this machine and is focused onto the stone. Okay, focused onto the stone in this beautiful lady here, beautiful lady here. But actually, you never see beautiful ladies with stones. Usually, stones have the risk factors of obesity, diabetes, hypertension, high salt intake. So usually the stone patient is like this, not like this model here. So this is the machine. This is the machine for breaking the stones. So the success rate of breaking the stone is 95%. Only 5.6% will fail. But as I showed you in the earlier slide, stone-free rate is a different story. It's a different story. And of course, where do we hit? We hit the stone hard with a shockwave. It can cause bleeding. It can cause the hematoma. And if you hit the wrong place, like you hit the calcium in a nearby artery, the patient can bleed to death. Okay, so it's not exactly. Although people say I want to have keyhole surgery, I don't want to have surgery, I want to have alternative treatment. All this treatment does carry a risk as well. So this is the technology from the aircraft. So this is the collaboration between the engineer and the doctors to produce a machine to do shockwave therapy for stones. So this is the first machine that we have. Well, not in Kuching. This machine was in Kuala Lumpur. Actually, they put the patient in a water bath. So this is the doctor, this is the engineer, and this is the technician. We can also do this same technology in children, but of course it's painful. So the child has to be given an anesthetic, and of course the child is not going to cooperate with you. So we have to put the child to sleep, and of course there is a fixed focus. So people who are too fat, children who are too small, and also and of course they are nearby organs like the spleen, the heart, the pancreas. So all these organs have to be protected So the focus must be very sharp, right on the stone itself. Okay. Nowadays we don't use a bath. We use a small water bath, and we use a lot of lubricant gel. So this is called stone removal without surgery. This is available in a few centers in Kuching, and of course it's available all over Malaysia. It's not harmless. It's not harmless. It can cause bleeding inside as well as outside, and it takes time to break the stone. Some people think that they lie down on a machine. After 20 minutes, the stone is gone. No, it takes time. We do it slowly. We increase the shockwave very slowly. And as I said earlier, all these public forums, people are cost conscious, and straight away I give you the cost in the private hospital. It's about 5,000. It's done as a daycare under sedation, so you have to be accompanied. It's also available in almost all the big government hospitals. If you're a government servant, it's free. But if you are not a government servant or related, have a government servant relation in the family, I think it's about 250 ringgit. So it's a lot cheaper in the government hospital. The success rate, I must confess, it depends on the size of the stone. If it's a stone more than 20 millimeter, the success rate is only 66%. And especially if it's in the lower pole. If it's in the lower pole, the stone is in a dependent position. This is a study done by my friend, Dr. Rajendran in Hospital Kuala Lumpur some years ago. So success is never 100%, never 100%. So the patient, the customer must understand that before they embark on the treatment. So this is the patient. This is the patient with a stone here. So if you after shockwave, the stone is fragmented. What is fragmented? But remember that fragmentation is not equivalent to stone free. Okay, not equivalent to stone free. The stone fragments are still there, and also it depends on what is the definition of success. So some hospitals will say success is less than 3 millimeter. Last time, 20 years ago, they say success of shockwave is less than 5 millimeter. So if you have a stone that is 10 millimeter, you break into 2 pieces, it's considered success. But of course, I think that's not true, okay? It also depends on how hard you look for the stones. If you do an X-ray, they call the kidney ureter bladder X-ray. You don't see the stone, but if you do a CT scan, you may see the stone. So the success of treatment depends on how hard you look for the stone and how you define success. So this often gives rise to a lot of unhappiness between the customer and the patient. So this, I show you some examples. I think we still got time. It's only half an hour. So this is a patient with a stone. You can see the stone very well on X-ray. So after treatment, the stone disappeared. It's no more in the kidney, but actually the stone fragments are all in the ureter. Okay, all in the ureter. So after 2 sessions, it's all in the ureter. So is this success? I think it's not success. But if you look at the kidney, it's success, but the stone have not passed out from the body yet. In fact, if you go back to your kampong or go back to your longhouse and leave this stone in the ureter, it can cause infection. Patient can die from the stone fragments in the ureter. If you leave it there for a long time, if there's no infection, the kidney will block, so the kidney will fail. So actually, in other words, it's not success. So success is only when the patient have no more stones and the patients do not form any more stones. So that is very important concept of treatment of any medical condition. You must prevent the condition as well. This is another lady. I think she came from Sabah all the way to see me. That's in early days when Sabah don't have the machines. So they came here, and this stone is in the lower ureter. So it's just at the rambutan lower ureter. So I just put a scope in area. I remove this stone from below using a scope, to remove this stone. And of course, we have to fragment the stone before we remove it. Okay. And the stone is in the kidney, is the rambutan higher up. So if I put a scope up, you take a long time. I may even damage the ureter. So the treatment for an upper stone is by shockwave. So we shockwave the stone, and the stone is all broken. But if forming a street, it's called a stone street. Stone street in Germany, because this machine came from Germany, it's called Seinstrasse. So again, if I leave it alone, she will be in big trouble. So patients coming for treatment for stones will have to stay around Kuching for at least maybe up to a week to make sure that all the important stone fragments are clear. That it's safe for the patient to go home. We usually don't have to admit the patient, but have to be treated as an outpatient. Now, what if the patient said, I want to go home. So if the patient have to go home, then we can put the tube, we put a stent. We put a stent inside. We can put a stent inside. And for them to catch the stones, I give them a seed. I buy this from the DIY shop. Buy from DIY shop. So to catch the stones. But the trouble in developing countries, including in Sarawak, is that if you put the tube into the body and the patient go back to the longhouse, many patients do not have the ability, have the finance to come back to the hospital for the stent to be removed, because these stents are meant to be only for a short while only. So in the end, these stents either get broken or the stents by itself is the focus for forming a new stone. So that's the problem of stents. So remember, anybody in the audience who have gone for stone treatment, make sure that the stone fragments, the stone fragments, make sure the stent are removed. Okay. So this is the precautions, the precautions of stone treatment. So this is success rate. So if the stone is too big, then giving them shockwave therapy will not be enough. Okay, because if the stone is more than 3 centimeters, the success rate is only 43%. So we have to combine with another technique. We have to combine with another technique. Okay, so I mentioned earlier already, it's very, very important that no, we should not just treat the illness. Okay, we should not just treat the illness. Okay, we should try to treat the illness before it causes a problem, before the patient go into sepsis, before the patient go into kidney failure. Now, of course, the best thing is if we can prevent the sickness. And nowadays, I can tell you very openly that most of the medical institutions, most of the doctors are very helpful for you to have a second opinion, and the doctors may agree to disagree. So the culture for treatment for stones nowadays is quite different. So I think this is probably the most important slide for my lecture, most important slide. So prevention of stones, prevention of stones. So the most important prevention for stone is to drink enough fluids, especially water. Of course, you can drink coffee, green tea, misai kucing or whatever. The most important is to drink enough water. And the most important is to drink enough water to produce 2.5 liters of urine. Okay, 2.5 liters of urine. So in other words, you are playing golf, you have to drink more. If you're in the office, you don't have to drink so much. Okay. So there are some problems if you drink too much as well. There are some problems. We can discuss at Q&A. So if you produce 2.5 liters of urine a day, I'm talking about adults, not children. Adults, the normal 60 kilogram adult. Of course, if you're only 40 kilograms, you don't drink so much. So if you produce about 2 liters of urine a day, you can get rid of most of the toxins in the body. And of course, diet is very important. Diet is important not only for stones, diet is important for all medical conditions. So the diet modification is very important. So there are so many medications you can get in the market, so many medications you can take. If you go to see most doctors in Malaysia, Singapore, Australia, you'll be given this drug called URL. Some doctors will give you a drug called potassium citrate. So potassium citrate, URL is sodium citrate. The danger about potassium citrate is that potassium is toxic for the kidneys and for the heart as well. So you have to take this in moderation. If you go to the government hospital, they will give you this product called Ulite. Some people take an oily product called Ravatinex. Many Indonesian patients take this formulation called Sistone. It's also an oily formulation. And there are so many drugs that which can use to relax the urinary tract. So they call it medical expulsive therapy. So there are many medications you can try to take. What is most important in Asia is that many people take herbals. There are many herbals which you can take. I personally have no objection to herbals, except that many herbals nowadays, they have to put this rider. They put no approved therapeutic claims. In other words, this is a herbal. This is a supplement. They have no proof that it works. But I think main thing is that if you take a herbal, some herbals have got blood thinner capacities. So if they're blood thinner, then if you go for surgery like shockwave therapy, it can cause more bleeding. So sometimes some herbals are not compatible for surgery. So you have to stop the herbal for 1 week before surgery, and also don't take it too soon after surgery, because many of the herbals have got blood thinning capacities. So I give this picture to all my patients who have recurrent stone formation. Okay, this is my patient education picture lah. So the most important factor for stone formation is sodium. So too much sodium in your soy sauce, in your salt, in your MSG can cause stones. And in Malaysia, many of the stones are due to uric acid. So uric acid is found in abundance in nuts, chocolates, red meat, organs. They are found in abundance. But even if you're a vegetarian, you can also have high uric acid because uric acid is produced by the liver. And if the liver is stressed, you produce a lot of uric acid. So it's important not to have too much stress. The calcium always combined with oxalate. Okay, oxalate. So oxalate is found in abundance in starfruit, in spinach, and also in concentrated tea. So don't leave the tea back there for too long. So this will produce a lot of oxalate, and you drink the oxalate, you can have more stones. Calcium is another story. Yeah? Calcium is another story. We need calcium, but if you take too much calcium, you can have stones. So we can discuss calcium in the Q&A. Milk is good because milk got normal calcium. And as I said earlier, lemon is good because it contains citrate and it helps to dissolve the stones. If you have got infection, you must take antibiotics. And of course, for patients who are not allergic, you can take allopurinol to reduce your uric acid level. So this slide is given to all my patients as a preventive measures to reduce stone formation. So again, I emphasize again, fluid intake is the best, okay, to prevent stone formation. Not surgery, not laser, not medication. And if you have many stones over the years, then sometimes you have to even drink water at night, and you have to wake up at night to pass urine to prevent stone formation. So I'm coming to my last few summary slides now. So if you have a stone in the upper ureter or in the kidney, as I mentioned earlier, like the rambutan up there, you should try to use shockwave. If the stone is less than 20 millimeters, the success rate is 90%, but not one session. You have to have multiple sessions. And then if the stone is very big, we can do percutaneous surgery, make a hole in the kidney. But as I said earlier, a stone is an infective substance. It can cause infection. And if you puncture the kidney, it can cause bleeding. If the stone is the lower ureter, usually we do in the lower ureter here, we do endoscopic surgery. If the stone is the upper ureter, there's a danger of damaging the upper ureter. And if the stone is in the bladder, of course, it's very near. In the female, it's very short. In the man, of course, you have to go through the urethra. And then we try to remove the stones by endoscopic means, by crushing the stone by using laser. In children, in pediatrics, you have to be careful, especially in small boys, because if you pass too many instruments up the penis, you can damage the urethra. So sometimes in children, if there are many stones, we do open surgery. And again, medical therapy is important. Any stone less than 6 millimeters, there's a very good chance that it can pass out by conservative therapy, by drinking a lot of water. So if it's a very small stone, try not to ask for surgery. Yeah? Try not to ask for surgery from the doctor to have the stone removed, because surgery has got its side effects. Okay, smaller stones, you can give them less than 5 millimeter, have more than 90% chance of passing, especially if you give them a drug to relax the urinary tract, like tamsulosin or one of these drugs that we use, actually traditionally used for hypertension. And if you've got high uric acid, we give them medication to bring the uric acid down. The commonest drug we use is allopurinol. So that's my summary slide number 1. Summary slide number 2 is more important. Again, we have to emphasize. We have to emphasize to the patient to drink enough fluids. This is the best preventive measure. So I've said this, I think, many times during my lecture. And if you come to the clinic, the nurse will emphasize it. If you go home, your family will emphasize it to you. So it's very important that if you see a doctor, bring your wife, bring your family, bring your son, bring your daughters, and they will help you. They help you to drink, to ensure that you drink water. And how do my son ensure that I drink water? My son gave me a bottle. Okay, say, Daddy, this bottle is 2.5 liters. Make sure you try to finish it every day, if not at least finish half. Okay, so that is important. And diet modification for the patient. But the patient usually don't eat alone, they usually eat with the family. So it's important the family participate in this diet modification to prevent disease. Stones, any disease, hypertension, diabetes. It doesn't make sense that, the patient has got diabetes and the whole family take a lot of sugar. So it's a family effort. And if you have to take a medication, urinary alkalinizer will help. So this is my last slide. I think we have purposely left behind 15 minutes for Q&A. So I welcome Q&A. Let me see what are the questions on the chat. So we can answer the questions. I think the audience have no chance to participate, right? They cannot participate. Okay, so these are the questions from the audience. The first question is, does taking calcium supplement cause stones? Okay. Calcium is a very important component of the body, okay, for the heart to contract, and it's a huge component of the bone. So a lot of menopausal women, they take calcium supplements. And some of these women who take calcium supplements end up having stones. So in other words, if you have a tendency to form stones, you should not take calcium supplements, but you should take normal calcium, because if you don't take calcium, you have fractures. Okay, so if you have a history of recurrent stone formation, please do not take calcium supplements, but you have to take a normal calcium diet. Okay, so that is the thing, right? So you don't take low calcium diet, but you can take a low salt diet, low oxalate diet, low uric acid diet. And of course, most important, you drink sufficient water. Okay, the second question is, I read the question from the audience. Do drinking more water reduce the possibility of stone formation? Okay, so this is in relation to the volume of water. Some people, when they wake up in the morning, they will drink 1 liter of fluid. And they tell me they drink 7 liters of fluid a day. 7 liters of fluid a day. Now, if you drink too much fluid, and if you're elderly and your heart is not so good, you can have fluid overload. You can get into what is called pulmonary edema. In fact, I have one elderly gentleman, he was admitted to ICU after he took the advice from the doctor, drink a lot of water. Okay? Or of course, as we grow older, we do a CT of the brain will show atrophy. Notice the brain is a bit smaller. And you think that you drink more water, the brain will expand, you'll get better memory. No. So the volume of liquid you drink must proportionate to your activity. So I mentioned earlier the magic figure of 2 to 2.5 liters of urine. So if you produce 2.5 liters of urine, that's sufficient. Don't drink excessive water. So that's the thing. And the other problem about drinking excessive water is that the kidney will work too hard. So they call hyperfiltration. So if you have hyperfiltration, the kidney also can be damaged. Just like you run your car, you run your car 24 hours, you don't stop the car. The car engine can be damaged. And what about alkaline water? Okay, I mentioned earlier, you need to alkalinize the urine such that the uric acid will dissolve. But if you drink alkaline water by itself, I think the alkaline in the water is very minimal. So I must say that there's no scientific evidence that alkaline water will reduce stone formation. But of course, the fact that you drink water will reduce stone formation. What sign should I be looking for to know that I have stones? I've shown you one of my earlier slides. 50% of the stones are diagnosed by routine scanning, routine ultrasound, 50%. You have no symptom, nothing. The second important symptom is that when the stone drops into the ureter, you got pain. And the pain is a classical pain, loin to groin pain, from the loin to the groin, okay, classical pain. So if you got severe pain in the back going to the front, then you got a stone in the ureter. The third thing is when you got blood in the urine. You got blood in the urine, of course, the blood in the urine can mean that you have something else. Could you have a cancer in the bladder or cancer in the kidney? But if you got pain and blood in the urine, and if you're a young person, it's likely that you got a stone, likely you have a stone. And the other thing, of course, is infection. If you keep on having urinary tract infection, pain on passing urine, dirty urine, then you may have a stone. So these are the symptoms that you should go and see a doctor and arrange for a scan. Usually we do a scan to start off with. I do an ultrasound first. Ultrasound, you show a scan, then we do an X-ray, then we do a CT scan. So that's the investigation pathway to confirm that you got a stone before we talk about treatment. All right, I got another question here. Good morning, Dr. Lei would like to inquire. Does alkaline water help to reduce stone? I think it's the same question as the previous one. Alkaline water may have some other health benefits, which I'm not very familiar with, but the alkaline water by itself, as compared to normal water, I think there's not too much difference. The most important, you should drink enough water. Not too much water, drink enough water. Does drinking 1 liter of water reduce stone? So 1 liter of water, okay, let's talk about how you drink the water. The idea is to produce 2.5 liters of urine per day. It must be over the whole day, the whole day. So it doesn't make sense for you to produce 2.5 liters of urine in the morning And in the afternoon, when you play golf, and night time when you go to sleep, you don't produce enough urine because the stone will form in the afternoon, the stone will form at night. So you should try to make sure that the 2.5 liters of urine is mostly throughout the whole day. And if you are forming stones, you may have to drink water even at night to produce the urine. So any other questions in the chat? Okay, if there are no other questions, okay, now it's 11:51 already, 11:51. If no other questions, maybe I make some closing remarks, maybe to anyway. I think you can always send questions to the, I think there's I think this is a normal forum, so I think there is an inquiry forum, so the patients can always ask them questions to the inquiry forum, and we'll be happy to answer the questions later on. The inquiry was sent to the appropriate specialist, especially talk about the alkaline, just especially the alkaline water, because alkaline water may have some other health benefits, which my colleagues, Dr. William Chow, can answer regarding the effect of alkaline water on the kidney function. So ladies and gentlemen, friends, and the patients. So just to summarize, so urinary stones is very common. Quite often it can cause pain, fever, blood in the urine, but often it's painless. You have to go to do a scan. If you do find a stone, you must discuss with your doctor what is the best way to remove it. Very often it can be removed by conservative means without having to go for surgery. And even if you do go for surgery, very often you don't need to have a big operation to remove the stone. And remember that removing the stone is only the beginning of the management. So you try to go for prevention of the stone by drinking enough water. And if they have any underlying problem like high uric acid, high calcium, this must be tackled. And of course, the treatment and the management of any condition involves the teamwork by your medical team, and also by teamwork by your family, your spouse, your wife, your husband, your family members, so that you work together to prevent the condition from occurring. And of course, especially in these days of COVID-19, our resources are limited. So it's very important that they work together to live healthily. So thank you very much for attention, and I look forward to seeing some of you and also to answer any further questions. Have a wonderful day. Bye bye.